What if I told you that some of the medical tests your doctor routinely orders could actually be shortening your life after 70? Not helping it, shortening it. Last month, Martha, a 74-year-old grandmother from Ohio, went in for what she thought was a routine checkup. 3 weeks later, she was recovering from unnecessary surgery, dealing with complications that left her weaker than before she ever walked into that doctor's office. And here's the thing that should terrify you. Her doctors followed every single guideline by the book. I'm about to reveal 5 medical tests that major healthcare organizations now say do more harm than good for people over 70. And number 3, it's probably scheduled in your calendar right now. Before we dive into these 5 tests, you need to understand something that the medical community doesn't talk about openly: the concept of overdiagnosis. And what happened to Robert, a 76-year-old veteran, perfectly illustrates why this matters so much. But I'll tell you his story when we get to test number 2, because it directly connects. Here's what overdiagnosis means: finding something that looks like a problem on a test, but would never actually cause you harm in your lifetime. For someone in their 40s, that's one thing. But after 70, the treatment often becomes more dangerous than the condition itself. The American Geriatric Society has published what they call the Choosing Wisely Guidelines, tests that doctors should think twice about ordering for older adults. But most doctors keep ordering them anyway. Why? Well, there's a financial incentive we'll expose in just a moment. But first, let me tell you what happened to Martha that I mentioned earlier. She had a routine screening test, we'll cover which one soon, that found something suspicious. Not dangerous, not symptomatic, just suspicious. That led to a biopsy. The biopsy showed slow-growing cells that would likely never have caused problems in her lifetime, but now that they found it, the pressure to treat it became overwhelming. The treatment led to infections. The infections led to hospitalization. The hospitalization led to delirium and muscle loss. 3 months later, Martha went from independently living in her own home to needing assistance with daily activities. And the worst part? The test that started this entire cascade is one that 60% of people over 70 are still getting every single year. I'll reveal which one in just a minute, but first, you need to know. Test number 1, annual Pap smears. After age 65, if you're a woman over 65 who's had normal screening results and you're still getting annual Pap smears, you need to hear this. The American Cancer Society, the U.S. Preventive Services Task Force, and the American College of Obstetricians and Gynecologists all agree. If you've had adequate prior screening and no history of serious precancerous cells, you can stop cervical cancer screening at 65. Why is continuing harmful? Because the rate of false positives skyrockets. A false positive leads to more invasive procedures, biopsies, anxiety, and potential complications, all to chase down things that aren't actually problems. Studies show that in women over 65 with adequate prior screening, continuing Pap smears prevents less than 1 cancer death per 10,000 women screened. But those 10,000 tests lead to hundreds of unnecessary procedures with real complications. Now, before you think this is just about rare tests, wait until you hear about test number 4. It's something 80% of seniors do routinely, and it's causing an epidemic of dangerous overtreatment. But next, test number 2, PSA screening for prostate cancer after 70. Remember Robert, the 76-year-old veteran I mentioned? Here's his story. Robert had no symptoms. No problems urinating, no pain, nothing. But at his annual checkup, his doctor ordered a PSA test, a simple blood test for prostate cancer screening. His PSA was slightly elevated, not dramatically, just slightly. This led to a biopsy. The biopsy found slow-growing cancer cells. Now, here's the critical part. Most prostate cancers in men over 70 grow so slowly that men die with them, not from them. But once you find it, the pressure to treat is immense. Robert had surgery. The surgery left him with incontinence and erectile dysfunction, side effects that devastated his quality of life. 5 years later, his doctors admitted the cancer likely would never have caused him problems. The U.S. Preventive Services Task Force gives PSA screening in men over 70 a grade D recommendation, meaning the harms outweigh the benefits. The European randomized study of screening for prostate cancer found that you'd need to screen 742 men to prevent one prostate cancer death, while causing complications in dozens. And if you think PSA screening is controversial, wait until you hear about test number 5. It's created a billion-dollar industry built on fear, and the science behind it is falling apart. But first, there's something even more common that's causing problems. Test number 3. Annual EKGs and cardiac stress tests in asymptomatic people. This is the one I mentioned that might be in your calendar right now. If you have no symptoms, no chest pain, no shortness of breath, no heart problems, routine annual EKGs and stress tests don't help you live longer, but they can hurt you. Here's how. These tests frequently show abnormalities that are either false positives or findings that would never cause problems. This leads to more invasive testing, like cardiac catheterization, which carries real risks. Bleeding, infection, kidney damage, stroke, even death in rare cases. A major study published in the Journal of the American College of Cardiology followed over 40,000 adults and found that routine cardiac screening in people without symptoms didn't reduce heart attacks or death, but it did increase unnecessary procedures by 28%. The American College of Physicians specifically recommends against routine cardiac screening in low-risk adults, including most people over 70 without symptoms. Think about that. More tests, more procedures, more complications, but no benefit to your lifespan or health. Now, the medical establishment has gotten really good at scaring people about the next test on our list. In fact, entire industries have been built around it, and when you hear which one it is, you're probably going to be shocked. Test number 4. Annual bone density scans, DEXA scans, after initial screening. This is the one that 80% of senior women are doing religiously and unnecessarily. Here's what your doctor probably hasn't told you. If your initial bone density scan is normal or shows mild osteopenia, you don't need annual rescreening. The bone loss simply doesn't happen fast enough to warrant it. The American College of Physicians recommends rescreening intervals of at least 5 years for women, and potentially as long as 10 to 15 years if initial results are good. Why does this matter? Because each scan creates anxiety and often leads to prescribing medications like bisphosphonates, Fosamax, Boniva, that have serious side effects, jawbone death, unusual fractures, esophageal cancer, and severe bone and joint pain. Studies show that in women with mild bone loss, these medications prevent about 1 fracture for every 100 women treated over 3 years, but cause side effects in up to 20% of users. Plus, here's what they don't tell you. The radiation exposure from repeated DEXA scans, while small, adds up. Annual scanning provides minimal benefit while creating a cascade of treatment with real risks. But if you think the bone density industry is aggressive, wait until you hear about Test 5. This one generates over $8 billion annually, and new research suggests it may be causing more cancer than it prevents in people over 70. Test number 5. Annual mammograms after age 75. This is the most controversial one on this list, so stay with me. The research is clear but uncomfortable. After age 75, especially if you have serious health conditions that likely limit your lifespan to under 10 years, routine mammograms cause more harm than benefit. Why? Because breast cancer found in women over 75 usually grows slowly. Very slowly. Treatment, surgery, radiation, chemotherapy takes months and comes with serious side effects. For women with limited life expectancy from other conditions, they're more likely to die from heart disease, stroke, or other causes than from a slow-growing breast cancer. But every mammogram in this age group has a high rate of false positives, up to 61% over 10 years of screening. Each false positive means more imaging, biopsies, anxiety, and often treatment of cancers that would never have become life-threatening. The American Geriatric Society recommends against routine mammograms in women over 75, especially those with chronic health conditions or life expectancy under 10 years. A Canadian study following 90,000 women found that after age 75, mammography didn't reduce breast cancer deaths, but did increase rates of surgical procedures by 30%. Now, before you think I'm telling you to avoid all medical care, you need to hear what you should be doing instead. Here's what matters after 70. Personalized medicine, not protocol-driven medicine. Instead of routine screening tests, focus on symptom-based care. If something is bothering you, absolutely get it checked. Pain, bleeding, a lump you can feel, changes in your body. These warrant investigation. But screening for problems you don't have? That's where the harm comes in. Functional assessment. Tests that evaluate your balance, strength, cognitive function, and ability to live independently matter far more than screening tests. Falls kill more seniors than the cancers these tests look for. Quality of life preservation. At 70+, the goal should be maintaining independence, mobility, and joy in your daily life, not adding years filled with medical procedures and side effects. Talk to your doctor specifically about your risk factors, your health conditions, and your goals. Don't just accept routine orders. Ask these exact questions. What will finding something change about my treatment? What are the risks of this test itself? What happens if we don't do this test? Is this recommended for someone my age with my health conditions? The best doctors will appreciate these questions. If your doctor gets defensive or dismissive, that might tell you something important too. Remember Martha from the beginning? She's doing better now, but she wishes someone had told her these things before she went through months of unnecessary treatment. Medical care after 70 should be about living better, not just testing more. These 5 tests I've shared aren't harmful for everyone, but after 70, the equation changes. Your body is different, your priorities should be different, and your medical care should reflect that. If this video gave you information your doctor hasn't shared, hit that like button and subscribe, because I'm creating more content to help you navigate healthcare as a senior with wisdom, not just fear. Drop a comment below. Which of these tests have you been getting? And are you going to have a conversation with your doctor about whether you still need them? Your health is precious. Make sure every test you take is actually protecting it, not putting it at risk.